Good afternoon, everybody, and welcome to Avarion Insights. I'm your host today, and my name is Patti Strohla, and I thank you for joining us. In this two-part series, we're talking about one of the most misunderstood and powerful drivers of healthcare transformation, and that's healthcare governance. Today, we're going to break down what governance really is, why it's so hard to get it right, how decision rights and accountability can accelerate change rather than slow it down. In a future episode, we'll dive deeper into the structural components of healthcare governance. I'm super excited about this conversation and looking forward to what our guest contributor has to say. Our guest today is the incredible Madelaine Yue. Madelaine is a healthcare strategist who truly lives at the intersection of big vision and real world execution. Madelaine partners with healthcare executives to align competing priorities, design clear and achievable strategies, and turn complex initiatives into like enterprise EHR and ERP programs into meaningful results that improve both patient outcomes and financial performance. Based in the San Francisco Bay Area, Madeline holds a Master of Public Health in Health Administration and Management and Policy from the University of Michigan and is widely recognized throughout as a leader in healthcare transformation and digital innovation. You'll often find Madeline speaking on panels, sharing insights, and helping shape the industry's future. Madeline, we are absolutely honored to have you with us today on Avarion Insights.
Thank
Welcome.
you so much, Patty. Appreciate the opportunity to be here.
Let me start us off by asking a question. When people hear governance, we tend to roll our eyes and think of bureaucracy. In healthcare, what actually is governance? And more importantly, what is it not?
That's a really great question. I think that's one of the biggest challenges that we have today in many terms that are being utilized. There's so many different interpretations of what it means, but having clarity around that really drives the ability to execute it well, right? So I like to describe governance as a structure for decision rights, accountability, and oversight. Governance really, if executed well, allows you to clarify who's deciding what in an organization. There's kind of the organization-wide governance, but there's also elements that are very much needed for specific projects. And I think a lot of people tend to associate it with projects because it's when you have something intense that an organization is going through. I think that's an area that organizations tend to focus in on. But it interweaves and it has to connect with each other for it to be done well. Who decides what for the organizational strategy, the organizational direction should intertwine with how decisions are being made for a specific project, a specific initiative, or a group of projects associated with each other. It's really essential in healthcare because it drives that clarity. And in healthcare, I think why it's even more essential is we have so many interoperability, for a little bit technical of a term for those who are not as familiar with that, but I think intersection points between departments, right? Departments are not able to just function on their own. If you think about a patient, they flow through departments and they have to work as they're being treated. They're being seen in multiple areas, and so that means all these different areas: a clinical person, operational person, administrative. I mean, it even goes all the way down to housekeeping when you're in a hospital, right? Where all of those elements affect each other. And so it's important to think about governance as a whole in the organization, as well as how to frame it for specific initiatives that they're engaging in. I think a great example is like with data right now. If you have a department where there's several people that say they own, let's say, data quality, right? Patty, you own data quality, I own data quality, we're working in the same department. Well, that creates unclear accountability. I don't know who actually owns it. I don't know who's making the decision. I don't know who is creating the vision of where we're going with things. And so that's where governance helps to structure it and make it clear on decision rights and accountability over everything.
As I listen to you talk, it's actually expands even beyond an organization and a division or a department because we have our public sector,
Yeah.
we have our payer sector, we
Yeah.
have our regulations, which come out of Washington and
Yeah.
at the state level. And our
Absolutely.
governance needs to intertwine into all those areas as well.
Oh, that's a really great point. It's not just internal to an organization. When you're in an industry that is heavily impacted by other industries, maybe it's sister organizations like payer versus provider, right? Because the payers are the ones who are driving the financial reimbursements that the provider organizations have. Hospitals are highly dependent on them. And so there needs to be some level of interactions and collaborations there. But you nailed it with the regulatory component, making sure that there's visibility into that, and whether that's an organization, from the internal side, having people that are designated to stay on top of those government affairs, whether it's state or federal, or being highly engaged with organizations, members of organizations, like a great one that I know Avarion was present at as well, Chime Fall Forum, right? The Chime organization is fantastic because they have an entire division that focuses on policy that helps alleviate that deep dive that hospital members have to do, and they can collaborate through that organization. But you're absolutely right. It's both internal and external. Yeah.
And on the internal side, today more than anything, we're also seeing uh, independent health systems partner for economies of scale. And
Yes.
when you partner for economies of scale or shared services, again, that's yet another layer of governance.
Another layer of governance, another layer of collaboration. Anytime you have stakeholders that, or I would say, core stakeholders or partners that have a significant potential impact on your organization, there's an impact on how your decisions happen. And so when you are not the sole owner of a decision, and that's very true in healthcare today, because we're at the whim of a lot of government reimbursement programs, right? That's the hot topic this year is, with every change in administration, without going down that rabbit hole, every change in administration, every change in, legislation that impacts whether it's full like healthcare reimbursement, or maybe it's even something as simple as them putting out recommendations or guidelines around how we utilize AI. Those all have impacts on how we individually, as a provider organization, a hospital, a health system, a clinic, makes decisions. And so being conscientious of that and identifying ways to impact that conversation or stay abreast of the latest news of that conversation has to be folded in and incorporated into your internal governance as well. Yeah.
Yeah, excellent, excellent. You mentioned a couple of terms, uh, decision rights, accountability, oversight. Why is it so difficult in healthcare to actually get it right?
That's a great question. I think for me, I hinted a little bit on it on the earlier question, was the highly integrated aspects of healthcare delivery. You even went further on that with going to the external, but even just internally, it's so complex because you're not just executing in one department. You're not executing in a silo. I think of, like, if I compare it to other industries, you can isolate certain workflows and or isolate certain businesses as completely contained in one environment, right? But in healthcare, because I think if you think of the complexity of the nature of a human being and our physical kind of disease manifestations, and even our health manifestations for preventative care and everything, it's so complex, so it intersects with so many different areas. So when you look at the operations of a hospital or a clinic, you've got the complexities. I'm just going to do a really high level one, right? A patient comes into the ER, they're being assessed for an urgent situation. You're not just talking to the nurses in the ER, right? They're going to be looking at, we need to do diagnostic tests, so we have to interact with the lab. We need to deal with possibly some imaging scans, so we might need to work with the imaging department for maybe an MRI or a CT or even X-rays if it might be a fracture, right? We might also be concerned about some behavioral health aspects, and so we might need to call the psychiatrist over from that's on call. And that's even already going to the clinical step. As the patient presents, you've got the registration staff, you've got kind of the triage nurse that's assessing the different aspects of it. And then once they're in there, when you think about operationally in a hospital, you've got housekeeping that's coming in, and all of these different departments don't all report to the ER. They're collaborating with the ER. So what you have is what in a lot of other industries we talk about matrixing and cross-functional collaboration between departments. That is a daily minute by minute aspect in healthcare. That cross-functional collaboration is an essential piece to make sure that patients are treated well and are given the care that they need in order to create a more healthy community. And so, with that, I think that aspect creates overlapping authority. So, just that example I just gave, the psychiatrist doesn't report to the emergency department, right? They report to probably the behavioral health department. Lab is a completely separate department. So, if ER is saying, why can we not get labs in a timely manner? Why do we have issues? The ER director does not get to decide how lab runs their business because that's a completely separate department that has a lot more complexities that I'm pretty sure the ER director doesn't want to deal with all of the regulatory aspects and all of the processing aspects within lab. And so that's that compartmentalization, while it's purposeful and it's necessary in order for us to run hospitals and health systems properly, it adds that added challenge. Is there's frustration, there's naturally going to be aspects where people are going to be bumping up against each other, and from a patient perspective they're like, I don't care, I just want to be treated. So that creates a lot of confusion. And so that accountability gets diluted when you add that many more components to it. Yeah.
I think, what do you think about, we also have external variables that are not within our control or
At
control of
all.
any human for that matter.
Hmm.
You know, whether those be uh, weather related, whether they
Hmm.
be mass casualty events, whether
Oh,
they
perfect.
be
Yeah.
uh,
Hmm.
internal disaster protocols, whether they
Absolutely.
be special events. You
Absolutely.
know, we're constantly in flux. Healthcare is very rarely a single episode. It's a continuum, as you mentioned.
Absolutely. I mean, you nailed it because, and I love the EER example for that because they're the ones who are going to get hit typically by a lot of those elements, especially if it creates an influx of patients. But there, it's not even just the influx of patients. You've got natural disasters that can cause power outages, that can take down, is the hospital's redundancy for, power, for not just power nowadays with technology being such a dominant aspect of any hospital being able to function. Do they have the downtime procedures down? Have they done the table reads to practice that so that they know how to effectively execute that? And then in addition to that, it's like I just kind of take that train of thought with emergencies. Something happens, a natural disaster, a motor vehicle accident. You're not just collaborating within your existing organization, as you were saying, the external collaboration with the transport systems, the ambulances, the fire departments, all the emergency services that are trying to coordinate with you. And it is a complexity that a lot of other industries just don't have. And that creates more factors of, again, making sure you have the clear decisions within your control, right? Because there's only so much you can control as an organization. Also, creating the partnerships in those governance structures, that collaboration with your right designated sponsor, designated representative from those partner organizations.
Or a hospital on the other side of town where you might be competing for the same population and the same services, but when the need arises, you
You
have
have
got
to
to have
collaborate.
those processes in
Yes.
place to support each other and collaborate.
Yes. And
Um,
it's not even just in emergencies. If you think about it, it's a very unique industry in the sense that when your patient gets seen at a competitor, you still need to coordinate care, right? So healthcare is very unique in that way. If you think about in the retail space, if I go to Target and Walmart, Walmart doesn't care what I do at Target. Target doesn't care, and they're not going to share the information, right? However, if I go and I'm in Northern California, so if I go to Kaiser normally, and then all of a sudden I have an emergency and I'm at a Sutter hospital, there's still a need because of the clinical information to share that across to take care of the patient. And so it's a very interesting dynamic. Your competitors, you're competing for market share of your patient, of the patient population in the community. However, if there's a specialty service or if there's an emergency, you need to have some way of being able to connect and coordinate so that you're doing the right thing for the patient. It's a very, very different industry than any other industry. And those decisions are hard. Those decisions are absolutely hard to coordinate.
oh, incredibly, yes, very much so. We've touched on this a little bit, but just interested if you have any other thoughts. It seems like governance matters more in healthcare than in other industries for a lot of these reasons we just mentioned. It's a unique, it 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 deals with a human. Um, Other thoughts around that topic?
Yeah, I think we touched on a little bit about it, and I think going further into it, it's the safety aspect is the human component. We're dealing with people. We're dealing with what happens in healthcare affects the entire community. If a hospital closes, that affects the entire community, and so that's a critical component. We have levels of compliance regulations, scrutiny from those perspectives that other industries don't have. I think the closest one with the regulatory constraints is probably the finance industry. Finance it has a lot of regulatory aspects that might be the closest in comparison. There are other industries that are regulated. I don't discount that, but because we're dealing with actual people and their lives, we appropriately have a level of scrutiny that's very different. Then you've got kind of we talked about the cross functional interdependencies, but I think there's also the aspect of because you're dealing with human lives, misalignment between functions has actual possibly life impact, right? It could have a death or life impact, life or death impact. And so I think that's a key element as to why it matters so much more in healthcare. I think related to that, I mean, there's been studies out there, and you can actually see that trend from an industry perspective as to why governance or the focus on governance in healthcare as well, because like HIMSS has maturity models for EMR progression, the MRAM, as well as analytics maturity models, AMAM, and they've incorporated governance as measured domains in evaluating the maturity of organizations. Chime has their most wired measurement as well. They have that lovely status that people get the accolades for when they release the latest list of those. They also have not just general governance, they actually have cybersecurity governance. So that enters a whole nother domain for us in healthcare technology because, you know, we're not just dealing with patients' financials. We have patients' financial information. We also have their personal health information, and so we're a very big target for cybersecurity attacks in across the world. And so that's one of those aspects where Chime has recognized that that's a really critical component. Even AHIMA has come out and said that governance is lacking in data, and that ability to share data and know and understand that data is not just to collect, but it's actually powerful to drive the business, and that's why governance has to occur there. They've been pushing that as well, and so I think there's industry across the industry, a lot of these organizations that are kind of these big organizations for in the US around healthcare information, all of those are focused on why governance needs to be in place in order to allow us to really maximize the advancements that we have through data and through technology.
And I think to balance that, though, is we recognize those needs for that security, that governance over the data, yet at the same time, we're yelling from the rooftops, we've got to share patient information, we've got to share patient information, the patient, again, that continuum of care, rather than having to be fiscally irresponsible and repeat things because we couldn't share data.
Hmm.
We have to figure out how to master that data governance.
Absolutely. Oh, absolutely. Absolutely. We really need to master. I think the data component is really important, and it becomes even more important as we're transitioning towards more and more advanced AI technology, because AI is only as good as the data that you have. And so if you don't have clean data, if you don't understand where your data resides and how it intersects and how these different systems are connecting, or the interoperability word again, you actually are going to limit how far you can go with AI, right? Because it will only benefit you when you know how your data is structured, how clean that data is, because you need to balance that with the controls around potential hallucinations and bias, right? And so that's a really important factor. But I even want, I mentioned earlier a little bit around the project component as well. Because healthcare is so dynamic too, we're constantly faced with advances in technology, changes in regulations. When you have cybersecurity risk, there's going to be more, federal input into guardrails to try to control that. So as we are facing all those different things, we're constantly in a world of lots of projects, lots of initiatives to try to stay ahead of those different evolutions in regulations, evolutions in technology, et cetera. And, I think that the literature, the research out there, especially around governance, has really shown that, without governance, major issues happen to projects. So there was a study that looked at 214 projects across multiple industries, including healthcare, and 65% of the major project issues that were occurring, that were slowing down or causing major problems, delays, scope change, all kinds of things for these projects, were due to inadequate management, including lacks and gaps in governance. And so it's not the technology or the budget that drives failures with initiatives. It's usually lack of clarity, lack of decision rights, right? And so it kind of circles back to all of those components that governance brings to the table. And because healthcare is constantly moving, constantly evolving, it definitely has a huge need for strong governance.
Yeah, and I know that that faces organizations every day, that dual purpose of engagement and
Mhm.
decision making around governance and monitoring, but we can't afford to slow it down either.
No, yeah, it'd be you get left behind. Absolutely. I even talking about just a little hint on the AI, not to go too far down that pathway, but the conversation just 3 years ago was, oh my gosh, we're this new wave of AI is coming, and what are we going to do with this? This is scary. Let's like watch. A lot of people just wanted to watch. Many of us were saying, many of the strategists in the industry were saying, if you're going to watch, at least start working on your data, start working on getting some AI governance in place so that you can start making decisions and have real use cases and not just get presented with shiny objects to pursue. But at the same time, I don't think many of us anticipated that progression was going to be so much faster than we've ever seen in healthcare, right? There was a report by Menlo Ventures just a couple months ago that said healthcare is spending 2.2 times faster than any other industry in the US on AI. And that's the first time in history that healthcare is leading the way in technology adoption. So all of that, again, requires that we have strong governance, because you don't want to go in and make investments in things that you don't have a proper use case for, does not align with your strategy too. It needs to align with your strategy. It needs to align with your goals. And that's all things that governance helps to put that structure in. Clarity, alignment with the organization, creating proper decision rights, so it's not just done kind of, I think that the term that we all hate in healthcare is shadow IT, the people just going and buying something without realizing that it impacts everyone else.
Yeah, that's fascinating that healthcare is kind of leading that. We don't necessarily see it in the systems we're using yet, but
Hmm.
it's interesting that behind the scenes that it's taking such a leap and people are grasping at
Yeah,
that to
yeah,
whether it's solve operational problems or whether it's to apply increased intelligence, like in the research arena, or whether it's to increase efficiency in what can be a dwindling workforce. So that's fascinating. Um,
absolutely. I did have one other thought just to really hit home on why governance is really important in healthcare is, when you think about the misalignment between functions having clinical consequences. A great example is I was working on a oversight for an EMR install just last year, and when they went live, the challenge there was, there were teams that did the configuration and everything, and the biggest challenge that happened was, somehow it got missed in the design process, was that there were certain imaging studies that required the patient to have a lab done right before performing the MRI. And for whatever reason, the setup did not support that workflow. And so, this is again the lack of that integrated workflow design, the lack of the proper parties being engaged in defining those key elements, And because that was a gap, thankfully it presented during go live, it resulted in a massive bottleneck because all of a sudden they couldn't get the patient over. They wasn't the lab order that was supposed to be tied to the MRI so that the lab could actually process something. And then you've got, and I think the sad thing was that the vendor's response was, oh, well, they can just process it. And so the vendor still wanted to troubleshoot it as a siloed, here's lab's problem, here's radiology's problem, instead of bringing everyone together and saying, okay, what do we need to do to actually make this work? What do we need to do to have this function properly? That's the concept that governance has, is there are decisions and decision rights that can be done at an individual department level. So the lab, when they're doing decisions around, how are they doing the processing of their equipment, things around maintenance of the equipment, their lab reporting, that's completely okay for it to be decided within lab. Once you start having handoffs between departments because of the integrated workflows, it's really important. It doesn't necessarily have to be at the top level. It doesn't necessarily have to be at the CEO level to make that decision. But when you create the right governance structure, I know we're going to go into more structural elements in part two. You can actually push those decisions forward and make sure the organization, make sure teams understand, ooh, we need to do this, we can hold this work group together, and these are the designees, so that we can come together and create that solution. And that's really important because, again, it's like the one thing you don't want is bottlenecks that delay care or create patient frustration or create reimbursement problems. Those three are probably the big things that pretty much crumble any situation in healthcare. So
I think it's important that we recognize what you just said. Governance is not one thing. It's not one committee, one group,
mhm,
one person, one decision. Governance is multifaceted, multi-tiered, and multiple layers. It's all part of governance.
absolutely.
Um, so to wrap up, to I have one more question for you.
Okay.
Can you leave us with some thoughts about how does an organization, what are some warning signs for an organization that their governance structure is starting to crumble or isn't effective?
I was thinking about this a lot, and I like to think in analogies. So I'll first, before I go into the analogy, some of the key elements are, all of a sudden these decisions are happening offline. So in hallways, oh, two people huddled and they made a decision, but it wasn't communicated well. You're going to see gaps that overflow into change management as well. I know you and I are both passionate about change management, but it's something that's kind of decided, oh, wait, when did we decide this? No one knows when it was decided, but so and so said it was decided, right? And so that's a failure point in governance because it's not clear. It's not, the clarity is not there. The understanding of the decisions and who's accountable for it was not there. So that's a big red flag. Another one is too many committees. So yes, governance is not a single layer, but also one of the tricky things is, how do you make sure that you're not over cumbersome and creating almost discussion paralysis, right? And so that can happen when you have too many committees. The flip of that is too few voices. So you have the right number of committees, but you don't have the right representation there. A flag, or kind of one of those big heat maps, is if you constantly see projects, organizations having to do rework, or you have key metrics that are competing against each other, that are misaligned. Those are other big red flags that there's a failure in the governance. What I like to think about from an analogy perspective, I was really reflecting about this because lately I've been like, oh, it helps to have a picture to parallel it with, not just saying, oh, I have to know this, this, and this for the industry. I was thinking about it from relation to, like, what game kind of gives you a picture of a fragile governance structure, and I was thinking of Jenga. Um, Jenga is a great analogy for that because Jenga, when you think about each block as being a governance component, a failure in one block, the removal of one block does not necessarily crumble the organization, right? And that's the thing where it gets really tricky. It can be a buildup of multiple things before you realize that your governance is failing you. So it is important to really understand that. But as people are pulling out blocks, the pulling out the blocks could be, ignoring processes, skipping steps, bypassing governance and making that hallway decision, right? The structure can still stand for a while, but at some point, if you continue to allow those elements and that governance to be bypassed, at some point Jenga will end up with it crumbling. There's never a perfect game where it stands tall and perfect forever, right? And I think that is really important to understand. And that is, I think, in healthcare in particular, we're moving so fast that it is very possible that your governance will still stand for a while with some blocks moving, some pieces, some steps being skipped. But as you continue doing that and allowing that to happen, again, that accountability component and oversight component, each missing piece accumulates to create that fragility that will eventually cause the governance to collapse.
No, I love that analogy. I always like to tell people that, I prefer to not build with, cinder blocks or concrete blocks. I'd rather build with Legos. So I
Yes,
can always look and say, if I don't like the yellow Lego next to the blue Lego, I can take it off and move it next to the red Lego. You have
but
to
they're still
constantly
solid because they're
review
still
and
connected really well. Yeah,
correct. You have
yeah,
to constantly review and revise.
yeah, absolutely.
Um, all right. So, Madeline, thank you so much for joining us today and sharing your expertise and vision. Um, I just love your perspectives on strategy and complexity and that whole governance side. It's just such a powerful piece of any organization having a strong understanding of that. Um, Remembering that healthcare change is not workflow alone, but it's people and process. It's the
Absolutely.
whole thing. A shared commitment to our end goal, which is improving our patient encounter and experience. And we have to have a strong healthcare structure and governance to be able to better serve our patients.
Absolutely. It's been a pleasure, Patty.
Thank you. And to our listeners out there, thank you for time. Please be sure to follow the Avarion Insights so you don't miss our next episode with Madeline, where we're going to dig more into governance maturity, some of the common pitfalls, good federation models, and how health systems can better design a decision structure that will actually work in our healthcare world. So until then, please stay curious, stay open minded, and remember together that we will continue to change the future of healthcare one insight at a time. Thank you, everybody.